Hi, I'm Becky DPT. Today, let's talk Achilles tendon pain. Achilles tendon pain happens just above that heel at the bottom of our calf muscle. Achilles tendon pain normally happens from tendinitis, which is caused by an inflammation and an overuse of the tendon, or it can be caused by a tendinopathy, where that tendon starts to actually degenerate. So it becomes worn, it becomes a little bit frayed, and you have the pain. So that is beyond that tendinitis, beyond that inflammatory period. So a lot of times we will feel pain, we will see some swelling, we can get some warmth right over that area, and it becomes kind of stiff, and especially in the morning. Causes of tendinitis or a tendinopathy is a lot of times when you start an activity. So if you start out an activity too quickly, or if you have something that you're doing repetitively, or if your shoes are not fitting you properly or don't have enough arch support in them. It can also be caused by poor mechanics, so poor running mechanics, or it can happen if your gastroc, which is your larger calf muscle, or your soleus, which is down below, if either of these muscles are weak or if they are tight. Treatments for Achilles tendon pain, starting out would be the Rice method. So you rest it, you ice it, you compress it, and you elevate it. So if you elevate that foot up above your heart, and even some ankle pumps to increase that circulation, bringing that good blood flow in so that it helps heal the area. Also being seen by someone who can help you determine how your feet are. So if you are a pronator, you're on the insteps of your feet. If you are a supinator, you land more on the outsides of your feet, which you can see the changes in my hip. So it can also be from a hip issue. If you've had a hip injury, an ankle injury, this can all affect Achilles tendon pain. A couple stretches that can be used for treatment are two different calf stretches. One is for your gastroc, which you would hang off of a step with the knee straight. This is for the larger calf muscle that attaches up above your knee and down into that heel. So you just hang with your knee straight and you hold for a good 30 to 60 seconds. A stretch is very important for the holding phase. And of course, if you have it on one side, I always recommend that patients stretch out the other side because it is very likely you'll get it on the other side. The other stretch is for your soleus. So you hang off, but then you bend your knee because you'll feel the tension being taken off of that gastroc, that larger muscle, from behind the knee. As soon as you bend it, this is from the soleus, so midway down into that heel that you hold it. And again, 30 to 60 seconds and both sides. Many times I see clients that do not stretch this way. Maybe they play football or they play soccer and they don't stretch out that soleus. Very important muscle to stretch. Another important exercise for strengthening this area would be heel raises or calf raises, in which we work the tendon. Because it is a tendon, we need to put pressure on the tendon, which is that eccentric contraction. You can even take it off of the side of a step. We can hold on if we need to, and we lift and we lower, we lift, and let those heels come down. That is that eccentric work. So it's lengthening that muscle, lengthening that tendon, and helping to strengthen that tendon. A couple other exercises I like to do with my clients that have an Achilles tendon issue is I like to have them squat and do a heel lift, because we get into that tendon. So it's the tendon which attaches our muscle belly to the bone, so you have to strengthen the tendon. It's not really about the muscle here, it's that eccentric, that lengthening phase of your muscle getting into that tendon. Another exercise I like to educate in is a stiff knee deadlift with a heel lift. And again, we're getting into that tendon, that Achilles tendon, for that strengthening. From the front, back is nice and flat, and coming up onto those toes. For any of the stretches that we did hanging off the side, they should be done 3 times each side, holding anywhere from 30 to 60 seconds. For the strengthening, the squat with the heel lifts, build those up to 30 repetitions if you're using a small weight. If you're using a moderately heavy or heavy weight and you've built up to that, you want to do 3 sets of 12. Hopefully you have learned something today that will help you get rid of Achilles tendon pain. Have a great day.